Hey there, welcome back to Unit 2, Plant and Animal Disease, where we're discussing digestive diseases in animals and jumping into part 2 of our lecture of a 4-part series in this section, where we're going to talk about impaction, acidosis, and peritonitis. And so let's jump into the first one. Impaction is where lots of times it's related to where an animal will get to the bunk and just eat a lot of carbohydrate feed. That produces a lot of lactic acid in the lower gut. And what it does is then produce a lot of negative reactions with regard to how the gut moves. And when we talk about rumen motility or gut motility, that is the stomach contractions or the rhythmic contractions of the digestive tract, whether it's the rumen or even down in the small or large intestine, that then somewhat stop working. So you'll find a number of causes that make that happen. So whenever that occurs, whenever you have feeder cattle, for example, that just really go and consume a lot of feed, or I've seen it happen with animals that consume just an overabundance of forage, or would, for whatever reason, chose to eat a bunch of sand or something like that, or dirt. Causes some cessation of motility in the gut. So as that happens, well, then you kind of get a plug, so to speak, in the system. So if you can kind of begin to picture it, we've put a plug in the digestive tract, and fermentation is still going on. We still have things happening, at least for some period of time. And so anytime that you still have fermentation, digestive process going on in the gut, in just about anywhere, and they don't have anywhere for the gas to go, gas builds up. And so that's why we call this impaction, is you have a section of the digestive tract that's impacted or plugged somewhere. Generally, when we look at clinical signs here, you're going to find a number of different things that may happen. Usually, whenever an animal is impacted, it's associated with some other type of disease. We're going to talk about displaced abomasum later on in this series of lectures, but it's oftentimes associated with something like that. Impaction in horses is oftentimes associated with colic, which we'll also talk about later on. But generally, it causes very, very severe abdominal pain. Animals will, grunt or grind their teeth or have foul-smelling diarrhea just because things aren't moving appropriately. Sometimes lower body temperature than normal, amongst a number of other things that you can read on the slide. If you have animals that can tend to become impacted, and especially if it's related to high intake of grain levels, then just a really good way to prevent that is to feed some sodium bicarbonate. What that does is help buffer the rumen and buffer the digestive tract, and that will help keep that gut motility healthy and keep the pH balance appropriate and keep those animals moving on and consuming at a healthy level. In terms of treatment methods, if it's grain associated, remove that grain and get them on some forage, get them on some hay. Treatment with penicillin is oftentimes important. One of the things with impaction, and especially if you get any kind of telescoping in of the digestive, especially small intestine, then you can begin to get adhesions, you can get stoppage of blood flow, therefore then infection setting in. So treatment of some penicillin is usually a cheap and good insurance policy to prevent any further problems. Maybe mixing in some baking soda. I've also seen, especially if you get to this slide here, where you'll drench them with a gallon of mineral oil. What that does is lubricate that impaction area and help get things moving along down the digestive tract. So that's really impaction. Not particularly a common one that you'll find. And again, if you do find it, it's most likely associated with something else, some other disease. Moving on, let's talk about acidosis, and we'll specifically hit horses to begin with. Generally not so common in horses, but associated with whenever they're really being exercised or worked hard, right after maybe a bout with diarrhea, that some other stressor that they've had, you can tend to see this set in. Sometimes caused by severe exhaustion, but usually associated with just an overall lack of equilibrium, lack of bicarbonate buffering capacity in the gut. When you're exercising horses heavily, they'll lose somewhere between 10 and 12 liters of sweat per hour. And if you've ever been out trail riding during the summertime and then get back to the barn and pull the saddle off, you see oftentimes that saddle blanket and the underneath of the saddle just drenched with sweat from the horse. And that sweat is heavy in bicarbonate, so they lose that salt capacity and therefore kind of lose some buffering capacity within their system. Whenever you see clinical symptoms of acidosis in horses, you'll see the number of things that we have listed here, just general listlessness, poor breathing. If you really get bad, that's into a coma, and probably treatment methods here. For most of us, when we talk equine, and those of you who own horses that are in on the class here, most likely you're talking about calling a veterinarian. If you can handle it oral, introduction of sodium bicarbonate, if you can get them to drink it, that's great. Most of you, if you have to go intravenous, are probably going to call your veterinarian. And then, it talks about addition of salt to the diet, 2 tablespoons per day. Most of you, I'm going to guess, would make available a salt block to horses. Horses need a lot of salt, and they oftentimes will consume it very readily as a condiment. Keeping a salt block in the stall or near the barn or in the pasture would be a great way to help prevent this. More commonly, if we move on and talk about acidosis in cattle, which is where you find it much, much more often, and specifically if we key in on feedlot cattle, finishers, and dairy cattle, you'll find that the acidosis in cattle is somewhat more common and a more common disease of one of the ones in the unit here. Generally caused by a number of things. The kind of list is rather lengthy on this particular slide and continues on the next one. It's almost always related to exceedingly high energy feeding levels, where we're really pushing a lot of feed, trying to get a lot of milk, trying to get a lot of average daily gain, and it just upsets the pH balance in the rumen. And you'll see, especially when we talk about protozoa and gram-positive bacteria, they cannot survive at low pHs. And low pH surviving organisms, they produce a lot more lactic acid, which then creates a lot of the things that we're going to talk about here in terms of clinical symptoms and problems within the animal. So you want to try and keep it, when we talk rumen pHs, normal rumen pH range is somewhere between 5.8 and let's say 6.3, 6.5, somewhere in that range, depending upon how much forage you're feeding them. And if you get an animal that slug feeds a whole bunch of grain at a time, and I'm talking, massive amounts of grain, or your ration is just very highly grain dense, very highly carbohydrate dense, you can quite easily drop that rumen pH down into the low 5s or even mid to upper 4s. And as you know from chemistry class, a 1-point change in pH is a 10 times more acidic environment. And so you'll not only kill off the beneficial rumen bugs, you'll also start to damage the internal rumen wall quite a bit just within the rumen. Some preventative natures, number one, and just great management practices, anytime that you plan on making a feed change, make those things gradual. Reduce as much stress as you can, deworm, vaccinate, keep feed available at all times. Feed some sodium bicarbonate. I know lots of producers that feed sodium bicarbonate just as a free choice lick pile out at the end of the bunk. And if you find an animal out there that's licking on your sodium bicarb, you tend to know that she's got a stomach upset. And it's kind of like you and I when you have an incident where you get a little heartburn, and one of the best remedies for that is some Tums, and sodium bicarbonate is essentially just that for ruminants. Treatment methods: get them off the grain, feed some hay, adjust that diet. Again, some preventative penicillin is usually pretty nice. If you get to severe cases, you might have to go to something like mineral oil and IV sodium bicarbonate. Get your veterinarian involved in treatment protocol there. Hopefully something that you're watching out for, but subclinical acidosis is fairly common in certain cases where we're pushing animals right to the line. Effects associated with acidosis, kind of ancillary things. Founder, where we have foot problems, begin to develop anorexia. Liver abscesses, that happens a lot in feedlot steers. It's somewhat common. You can get bloat, anaphylaxis, which is shock from toxicity, and it can cause death under certain situations, but that's generally unlikely. A bonus section that we'll have time for here in this particular slide set is talking about peritonitis, and again, something generally uncommon and most of the time associated with some other problem, and by definition is an inflammation of the peritoneum. The peritoneal cavity is the area outside of the digestive tract but inside the diaphragm or inside the gut area of the animal. And so you'll have some kind of inflammation or infection in that area that causes tenderness, pain, sometimes constipation will kind of set in after that, just as the animal reacts to the problem that they've got going on in their gut. Generally caused by some kind of penetration or perforation within the peritoneal digestive tract wall. Sometimes you'll get an ulcer in the small intestine or a tear in the small intestine, and so the digesta will leak out into the peritoneal cavity. That then obviously can be prime space for a bacterial infection to start in. Also, this is oftentimes associated with hardware disease, where you get a nail or a screw that maybe pokes slightly through the reticular wall, and then it causes some leakage or infection around the peritoneal cavity that way. So usually it's some other kind of internal problem, and the signs that you see tend to be associated with, and most definitely when we talk infection, you're gonna see elevated body temperature, a depressed animal, an animal that oftentimes very uniquely to peritonitis that's rigid in stance and doesn't lie down, and that's because there's something that's very painful in their gut about that. They may or may not drink a lot of water. It really depends on how and what kind of peritonitis they're dealing with. And most likely, if you check their pulse or heart rate, it's usually very rapid. I've had encountered a number of these animals, and you'll get a rapid pulse. That's one of the giveaways that it's something like peritonitis setting in. So treatment, if you find out that it's a perforation and surgery is called for, that can be successful if caught at the appropriate time. And then obviously broad spectrum antibiotics is the way to go here. Make sure and hit them, and probably hit them very hard, because again, that internal peritoneal cavity, perfect place for bacteria to thrive and really cause infectious reactions by the animal. So that's part 2 of our 4-part series here. We'll get back to you with part 3 in a minute.